Live from Columbia, this is WIS News 10 at 6. Live, local, now.
Welcome in. In just the last year, South Carolina has gone from more than half of its schools lacking access to mental health counselors to now 80% of them having it.
It is a turnaround that state leaders say needs to continue in order to address what they are describing as a mental health crisis among our students.
State House reporter Mary Green reports from one school where these changes are already making a difference.
The principal here at Batesburg-Leesville High School says she was seeing mental health challenges among her students before the pandemic. But once they got back from the shutdowns and remote learning, she says it was even worse, and they haven't gone away.
There's a greater need now than ever. And we are just so fortunate to have someone here who can serve those needs.
For the first time this past school year, Batesburg-Leesville High School in Lexington County had its own mental health counselor on staff, whom it shares with the nearby primary school. Before, the district partnered with the County Mental Health Center, but they were stretched thin themselves.
So there were many times we would go without counselors.
That was the situation in most schools in South Carolina just a year ago. In January 2022, Governor Henry McMaster requested a full review into school mental health services. And last May, the director of the state's Department of Health and Human Services reported back that the lack of counselors statewide was unacceptable. That prompted changes last summer, giving school districts more flexibility to hire counselors and increasing reimbursement rates to make those jobs more competitive and appealing.
Children are 21 times more likely to access a mental health service in a school setting than in another setting.
Now there are nearly 400 more mental health counselors in South Carolina public schools compared to last year, a 66% increase. 118 more schools gained access to a counselor in that time, and 80% of all schools in the state now have access to these services. There's district-wide access in more than half the state's districts.
Mental health is like a lot of other health conditions where if you catch something earlier on, it's easier to treat. The long-term prognosis is better and the long-term outcome is better.
Principal Sonia Bryant says students' mental health challenges won't go away overnight, but in just a year, she's seen more students show up for class, improve their grades, and get involved in ways she hadn't seen before.
It's about having that person you know is there and who can meet you where you are.
The state says more work still needs to be done in this arena, and Governor Henry McMaster has vowed to keep prioritizing student mental health services. Reporting Lexington County, I'm Mary Green.
And South Carolina's counselor to student ratio is much improved right now compared to a year ago, but by the end of 2023, the state wants to see an even better ratio to the equivalent of having a counselor in every single school in South Carolina.